Welcome back and congratulations, you completed your assessment. In this course, you've learned how to impress the examiners with a flawless performance, but most of all, how to believe in yourself and in a framework that makes you bulletproof, giving you multiple chances to correct your mistakes or add vital information if you left it out at any time. In this last module, I'll show you what else you need to prepare yourself with that is not included in this course. As you've known since the very beginning, this course is not meant to prepare you as a physiotherapist. You are a physiotherapist already, and you have your own baggage of knowledge. This course gives you the framework to pass the exam with great satisfaction and minimal stress. However, I don't know how prepared you are, how well your university prepared you, how long ago you did your degree overseas, or how much professional development you've done. Therefore, you need to self-assess your competences and study and practice, especially in the areas you think you are less prepared. In the bonus content, you'll find a list of the most common scenarios occurring in the Australian healthcare system, which will give you a rough indication about what you need to be prepared on. As a rule of thumb, you are doing well if you can perform each of those cases with your colleagues or mentors one-on-one in 40 minutes, following the structure you learned in this course. I gave you indications on how to treat your patient in the last module. However, you'll have to design your own exercises and plan your own treatments for each condition. The expected range of techniques and exercises is for an entry-level physiotherapist, so keep it really basic. Please remember to follow your cheat sheet and to treat only the impairments you will reassess. You won't need to remember all the treatment plans by heart. If you practice enough, you'll train yourself to detect the most important findings, select the most appropriate outcome measure, and use the right intervention every single time. It is imperative for you to base your exam on the assessment, so copy-pasting a plan you prepared before won't necessarily work. When studying and practicing your scenarios, build your treatment plans following evidence-based practice. Evidence-based practice takes in consideration three aspects. First, the current evidence or the lack of evidence for a certain modality of treatment in relation to a particular issue. Evidence changes over time, and it's your duty to be up to date with the latest research. Right now, the highest level of evidence generally relates to exercise, so make sure you prepare at least one exercise for each impairment of each condition of the list. 2. Your patient's preference. That's why it's important to negotiate the goals and get the patient to agree with the treatment plan. You want to have them motivated and working by your side, and they'll improve better when they've taken part in the decision-making process. Your patient might have had an injury before or already have been visited by a physiotherapist, so they can really help you choosing the right modality thanks to their perspective and their past experience. 3. Your personal experience and expertise. Focus on what you're good at and what you've seen working for you in the past. While mentoring other candidates, I've noticed that many are not confident with manual techniques. It's not a big deal. You'll focus more on exercise and advice then. Train your manual techniques if you know you need it. However, don't panic, because there's always multiple types of treatment methods that are effective for an impairment. So just make sure you have several options in mind and choose the ones that are most comfortable for you. Remember to train your manual assessment skills though, such as the use of goniometer, neurological assessment, and the special tests. This is non-negotiable, because if you're not proficient at this, firstly, you'll waste precious time during the assessment. Secondly, the examiners might fail you in some performance indicators if you're not able to bring to light the assessment findings correctly. You need to be across post-operative protocols and hospital discharge checklists for all the injuries and surgeries listed. Still consider that even additional scenarios might present in the future. In this case, you still have a great chance to pass, as the framework will help you tick as many boxes as you can. And if you apply your knowledge about all the other protocols you've learned, not much will be left to chance. Surf the internet to compare protocols of different hospitals in Australia, or find a contact at local university to access current material. We might add specific protocols in the future to the bonus material, depending on the level of evidence available. Now, safety is the scariest of all domains. One mistake here will cost you the whole exam, even if you did everything perfectly until then. The best way to prepare for this domain is to know all the protocols, as you have a higher chance to incur in safety issues in acute and post-operative conditions. The main areas of safety regard mobility, protocols, and practitioners' issues. Mobility. You must assess whether a patient can be mobilized or not, and how. You might find directions in the patient's file, ask your patient, assess the level of strength and pain, perform balance tests, or a mix of all the above. Depending on this assessment, you might decide to mobilize with supervision only, assistance of 1 or 2 people, and with a gait aid or not. Specific post-surgery protocols might influence your actions regarding weight bearing, range of motion, and active movements. So respect all precautions and contraindications during your assessment and treatment. As health practitioners, we must abide to our code of conduct at all times when we're the patient. We must use a reassuring and calm language to ensure our patient feels calmed and looked after. Also, we need to preserve our health and our patients by respecting hygiene and disinfection guidelines and safe positioning during the exam. Here's a list of tips for you, especially related to acute and post-operative conditions. Follow these advice whenever possible and relevant to the patient's condition. You can also download it from the link on this page. Check bed breaks and height before transferring. Check bed height in relation to your height and to what you're doing. Check crutches height before walking. Check grip strength and elbow extension strength before using crutches. Check hip abduction strength before walking. Check balance before sitting or standing or walking. Check the bandages for oozing and blood, but you must not open bandages. Verbalize whether you need assistance and ask the examiner to help you. Give clear instructions to your assistant. Ensure maximum comfort for your patient, asking frequently about it. Check for dizziness, blood pressure, and saturation when relevant. Give the appropriate assistance or supervision according to the condition and pass allied health notes. Ensure that specific injury or surgery precautions, restrictions, and contraindications are communicated and followed. If you're doing something particularly wrong, the actors themselves might save you, giving you a hint about what you're doing wrong. Always listen to what they say, especially if they repeat themselves. That's a clue about something that you need to take care of just right then. If they feel wobbly when walking, they feel that walking is not safe for them maybe. Pause for a second and see if you got anything. Have you checked balance, strength, or do they need an aid? If you realize a safety issue has occurred, just acknowledge it and fix it. Examiners will stop you if it's a major issue. So if they didn't, there's still the chance that you can save yourself by talking about the situation. If you don't talk about it, the examiners might think you didn't notice. Just admit your mistake or the oversight and amend it. Let's say you got your patient to stand up, but the crutches they're using are too high. That's fine. You're not expected to guess your patient's height. Just verbalize it, get the patient to sit down and change them. Safe, easy. Or for example, you ask your patient to sit at the edge of the bed, but the patient tells you the bed is too high. Don't panic. Acknowledge it and fix it before you go on. Or again, you start mobilizing, but the bed is too low for your back's safety. Stop there and verbalize it that you need it higher. Verbalize everything that you think, see, or do. You need to be always talking or asking questions, apart from when you're listening literally to the answers. I'll be offering one-on-one mentoring sessions to anyone who desires to improve their skills with a real-life scenario. The session will be a speed run of the exam with a cut-off time at 40 minutes. At the end of the session, we'll check together whether you were on schedule and whether there are areas that you can still improve. During these sessions, I'll share with you my ultimate protocols for the scenarios that we'll be practicing. These protocols have been reviewed and tested by myself and other real candidates during their own real exam. This is the reason why it took so long to create this course, and why I'm so thankful to all the candidates and experts who have worked with me to launch it and keep it up to date. In this course, you learned how to believe in yourself and in a system that works, that has been created for you by people like you, with the same fears and desires. People who have failed and then redeemed themselves. You won't go through the same process. You have my word and my guarantee that you'll pass. So enjoy the journey, study hard, believe in yourself, believe in the process. We'll be there with you until the end, until you become an Australian physio. I wish you good luck with your study and with your exam, and I'll be seeing you at our one-on-one mentoring sessions as soon as you're ready to take it to the next level.